Hi, and welcome to the Fertility Solution. I'm Dr. Jennifer Sims, and I will be spending a little bit of time with you guys today at lunch to talk about some challenges that pertain to fertility, all from a holistic perspective. If you have any questions, I request that you keep them to the end of the presentation. I'll be more than happy to answer any of them. And I'm easily reached if you have any questions that you'd like to have answered privately, either by calling me directly at 703-975-9144 or emailing me at jen@blueskyhealthandwellness.com. Okay, let's get started. So what is infertility? Well, basically, it's the inability to get pregnant within 1 year of trying or within 6 months of trying in women over the age of 35. Women unable to stay pregnant may also be considered infertile. There are so many factors to consider while getting pregnant, but the basic idea is a woman's body releases an egg from her ovaries. The egg has to go down the fallopian tube toward the uterus or the womb. A man's sperm must join with the fertilized egg along the way, and then the egg must attach inside of the uterus, which is called implantation. And any problems along the way of this natural process, there can be infertility that occurs. All right, here. Nearly 12% of women in the US between 15 to 44 years of age experience difficulty getting pregnant and carrying a pregnancy to term. Those are the stats from the CDC. Primary infertility is the inability to get or stay pregnant to term despite having unprotected sex for a year or longer. Now, let's look at some of the causes a little bit more deeply. Aging. The quality of our egg production is really important. It declines with age. The ideal age to get pregnant is between the ages of 21 to 34. 6% of your eggs are healthy after the age of 35. So you have a better probability of getting pregnant if you're keeping it within that window. And the viability of the health of the eggs are better if you do it within that window. Not to say that you can't do it and have a normal, healthy pregnancy after. That's just the ideal age. Some other causes of infertility are endocrine imbalances like your thyroid, your androgens, FSH, LH, progesterone, estrogen, testosterone. All of those imbalances. Are the hormones being made at the correct time? Are there any imbalances going on? This is another big one that I think is overlooked and not discussed enough, but what's considered oxidative stress. That would be air pollution, environmental toxins, smoking, drugs, radioactive exposures, actually living near a major highway, inhaling more gas fumes. All of those things actually have been implicated in causes of infertility. Medications, steroids, cancer meds, autoimmune medications, those need to be looked at for their side effects. Genetic disorders, endometriosis, which is considered ovarian inflammation, having a BMI or body mass index above or below 18.5 to 24.9. So if you're below 18.5 or you're way above 24.9, that body mass index definitely plays a role in your ability to get pregnant. So getting closer to that healthier range helps more positive outcomes. Male pelvic anatomical factors are important. In this journey, it seems to be that it lies mostly on the female. And the reality is it takes a sperm and an egg to have a baby. So having your partner involved is extremely important, and having his anatomy evaluated. I see oftentimes variceles or different low sperm count, things like that that are never evaluated in men that need to be, and are often very easily remedied, which will increase your chance of fertility. Female pelvic anatomy factors. Is there a problem with the uterus, the fallopian tubes, the ovaries, those type of things? And another thing to look at is, are you having regular menstrual cycles? Irregular menstrual cycles, not able to predict your next cycle. Polycystic ovarian syndrome, which is really challenging and a whole nother topic that we can discuss It's also important to look at. And also if you've had multiple miscarriages. These are all things that are going to affect your fertility. Now, can't talk about fertility without talking about men. So male considerations, poor vascular health, medications, smoking, obesity, low testosterone, stress, anatomical issues like cysts, having a vasectomy, prostate issues, diabetes, and sperm health, all are things that should be evaluated in the male when you're looking at couples and infertility. And just a side note, when I work with couples that are struggling with fertility, I really make it a point to have both parties involved, because this should be a team effort. It should not rely on one partner to do all of the work and the other one not to. And to have that support system for each of them is really, really important. So when we work with patients who have fertility issues, we often do extensive questionnaires and kind of do a deep dive into nutritional issues for both parties, stress issues, environmental toxins, all of those things. So we can get a really good clinical picture on maybe why you're having a harder time conceiving. And this can be for families too, or couples too, that have had multiple pregnancies, but then all of a sudden can't get pregnant again and want to. All right, what you eat really matters. If you've attended any of my webinars in the past, you know constantly we're talking about diet and nutrition and how it is food and how important it is for us to eat well. And you can't overlook that, you know, if you're trying to make a baby, you want to have good products in your system, right? So you want to try to the best that you can eat pesticide-free foods, organic foods. If you're going to eat fish, which there's a lot of debate about fish, but if you're going to eat fish, you want to eat wild caught fish with low mercury. You don't want any mercury if at all possible. Foods that are rich in vitamin E, okay? Anything with good fatty acids is really important. Foods rich in vitamin C, you know, we're looking at grapefruit, citrus fruits, kiwi, red peppers, those are things, kale, those are really great sources. Vitamin C helps trigger ovulation in women and increase sperm count in men, something to think about. Foods that are rich in folic acid, which is really important for that neural tube, how that baby forms in utero. Anything that has vitamin B is really, really important. And cruciferous vegetables, broccoli, cabbage, Brussels sprouts, all of those things help the liver metabolize estrogen. Specifically, vegetables like cruciferous vegetables contain indole-3 carbinol, which helps the liver metabolize. Okay, foods to avoid. When looking at your fertility, it's important that harmful foods be eliminated to reach optimal fertility. So high fat processed meats can create inflammatory process, and they also may be filled with hormones. So if you're going to consume meat, it's important to get grass-fed, clean sources of meat into your body. Quality matters. And I always recommend, you know, if you're doing a traditional non-extreme diet, right? Not a carnivore, not a keto, but just like a normal, healthy, more rounded, more like a Mediterranean diet. The palm of your hand is a good rule of thumb to see how much protein you should be eating per meal. My palm is very small, your palm may be larger, but that kind of is just a good tool to kind of measure what you should be eating per meal. Grains can increase cortisol and estrogen and lead to infertility issues. So it's not to say that you shouldn't have any grains. Not all grains are bad, but we want to have more complex carbohydrates, things that are better for you, not chips and fried food and things like that. Refined sugar can reduce your immune system, cause your nutrients to deplete, which also can, you know, increase your risk for diabetes and obesity, which when we first started off the risk factors for infertility, those were two things that we need to look at, right? If you're pre-diabetic or diabetic, or if you're tending towards obesity. Alcohol increases inflammation and reduces immune function. For women, heavy drinking is associated with a risk of ovulation disorders and endometriosis. Alcohol has to be metabolized through the liver. Hormones are made and manufactured and processed through the liver. So anything that's going to block or slow down liver detoxification, we don't want to do. So things to think about if you're consuming that wine all the time to unwind at night, you might want to think about stopping that if you're struggling with fertility. Caffeine's a big one. There's a lot of research coming out about the dangers of caffeine in relation to pregnancy. It can create hormone imbalances, dehydration, lead to mineral deficiencies. High consumption has been shown to interfere with fertility. So lowering or getting off caffeine completely is a really smart idea if you're struggling with fertility issues. Not to say that you can't have any, but if it's one of the things that you have not tried, I would strongly encourage you to get off of it and see if that helps increase your probability of getting pregnant. Stress is a big one, right? Who doesn't live in the space of stress? Stress is so, so important. And we've done a few webinars in the past about adrenal dysfunction and stress. We know that next to the ovaries, the highest hormone producing site in the body are the adrenal glands. There's those little ductless glands that sit on top of your kidneys, and they are designed for fight or flight. If your body perceives that it is a constant state of fight or flight, is that the time to get pregnant? Think about that. You know, if you're in a jungle and a lion is chasing you 24/7, that is not a time where the body feels that it's safe to conceive. The problem is most of us live in the space of chronic stress, either from foods that we're eating, a job that we hate, a relationship that's not great. You know, there's a million reasons why we're in a constant state of stress. So I strongly encourage all of my patients to really have a sit down with themselves and figure out what they can do to decrease that stress, because it will affect the probability of getting pregnant. Like I said, the adrenals next to the ovaries and testes in a male are the highest hormone producing sites in the body. So if they're overworking, that cortisol level is getting too high, you're going to be living in the space of what's called sympathetic dominance. And where you really want to be is in a parasympathetic state, the rest and digest state, a calming state to conceive. So that's really, really important, is sitting down and evaluating your stress. And if you have a history of long-term stress, then you need to think about what you can do to repair those glands, dietary changes, adrenal support, things of that nature. Emotional support is really, really important. And I can't stress this enough. You know, I tell my patients constantly, you can be at home, you know, eating rainbows and unicorns and exercising and doing all the things, but if you have a constant emotional trigger that is not being addressed, it negates all of the other things that you're doing. So you can eat well and exercise, but if your brain is not happy, if you're emotionally feeling anxious or depressed, those emotions can override the good habits that you have. So if there's an emotional upset, if there's something that you're not able to work through, you know, I definitely recommend looking at that and getting counseling, therapy, you know, exercise, whatever it is, prayer, meditation, whatever it is, because that will affect your ability to get pregnant, right? And there's been lots of studies and books on how we carry stress in the body emotionally and how we can actually pass that down transgenerationally. So think about that. Really think about, you know, you're bringing a life into this planet. And how do you want that baby to come in? Do you want it to come stressed and burnt out like you feel, or would you rather have a situation where you can encourage a healthy, peaceful environment as that baby enters into the world? Things that also, obviously, like I said, the caffeine, the stimulants will make your stress or cortisol levels higher. Walking, exercise, all of those things can help. And you know, it's hard. I've worked with couples that have taken them years. They've done everything. They've done the IVF. They have spent $20,000, $30,000 at a time. They've done everything. It's stressing their relationships. It's, you know, it's making them question a lot of things. Just the inability to get pregnant, not to get pregnant, excuse me, can be very stressful. And we need to talk about that. You need to have honest conversations about that. You need to realize, you know, it's okay to feel frustrated. It's okay to feel all of those things. So, and there's also a lot of support groups too that can get you through those times if that's something that you think that would help. Essential oils are a great thing. I get asked about this a lot of times. Essential oils for fertility. Some things that help balance your hormones. And once again, talk to your doctor before trying anything supplement wise or oil wise or oral or anything like that. But for the most part, there's a couple of oils that have been proven to help with some hormone imbalances. Topically, I'm not encouraging anyone to take them internally. That's not what's being discussed here. These are just things to consider. Geranium, it balances out your hormones, stimulates the adrenal cortex. It's great for the uterus and ovaries. Clary sage is really helpful for dealing with cramps during your menstrual cycle. It helps with stress, depression, anxiety. It's an estrogen mimicker. Oftentimes people will just take a couple drops, mix with some coconut oil and rub it on their abdomen. Lavender is just one that's really great if you're not allergic to it, to inhale. It's very calming. It calms down the nervous system. Fennel's been known to help the reproductive system. It helps regulate your menstrual cycle, things of that nature. So there's just a few. There's more, but just something to think about. Smells really powerful. So when you inhale something or you smell an essential oil, that goes right into the brain and it can definitely alter moods very quickly in a positive way. So if you like the smell of lavender and it calms you down, keep it in your purse, or frankincense or whatever it is, or wear a little bit on your wrist so that you can smell it throughout the day. Those things are just very calming to the body, and I would encourage you to do things that are going to help reduce those stress levels. Exercise. Okay, we know, everybody knows exercise is important. Some of us love it, some of us hate it. But the point is, movement is really what we're talking about. This is not about doing, hitting it hard or doing a CrossFit or HIIT training. That's not what I'm talking about. It's more about movement in the body. So if that means walking for you, that's important. If that's stretching, yoga, Pilates, anything like that, it will help boost fertility. And it'll help your hormones stay balanced. It's really important because exercise moves the lymphatic tissue in your body. The lymphatic system is the trash can of your body. If that trash can is backed up, you're not going to be effective in removing waste, which will not help when you're trying to get pregnant. So it's important. It's also a great stress reducer, right? So whatever it is for you, do it, but don't do it to the extreme, right? We don't want to do HIIT training if that's not what you normally do. Like if that's what you normally do and it works for you, that's fine. But if you were trying to get pregnant, we don't recommend all of a sudden going into a crazy intense workout because that's going to be stressful to the body. Over exercising can create hormone imbalances. So you've got to do what's right for you and in the increments. We don't want to be in the gym, 3 hours a day. That's counterproductive. And giving yourself recovery time between exercise is really important. Sleep, we can never, ever, ever get enough sleep, right? And it's not just about sleep. And the other webinars we've had talks about the importance of when you go to sleep, okay? It is important to have a healthy sleep hygiene. Saying, well, I get 6 to 8 hours of sleep, but I don't go to bed till 3 a.m. is not healthy. It matters the actual time of evening you go to sleep and how long you sleep and the quality of sleep. Are you getting up multiple times a night to pee? Can you not get back to sleep? Are you having restless issues? Are you uncomfortable? Are you in a high state of inflammation? Whatever those things are need to be addressed because you're not going to get restorative sleep if you're up super late, if you're tossing and turning, if you can't get back to sleep, if you're in chronic pain. Yeah, you'll sleep, but quality matters, right? So consistent bedtime routine is important. I encourage everybody to be asleep by 11, the latest, the absolute latest. Have a consistent bedtime. Stay away from blue lights because they're going to keep you up at night. That would be your phones, your iPads, the TV. You want to be in a dark room. So if you can't be in a dark room, get an eye pillow, cover those eyes up. Make sure that the room has a nice cool temperature. You don't want to be hot, especially with hormonal imbalances. A lot of us tend to wake up in the middle of the night sweaty. So you cannot overestimate the importance of sleep. And sleep, remember, we're talking about parasympathetic. That goes back to our rest and digest time, right? We need that state of being to make us more ample to get to conceive, right? So we need to be in that nice state of sleep and good REM. Okay. Supplements, guys. This is a really interesting conversation, and one that I would encourage, if you're a patient of mine, to have with me personally, because there is not a one size fits all for supplements. Some people need supplements. Some people don't want supplements. Some people have a fantastic diet and they get most everything that they need from their diet. I will say that if you're having a fertility issue, there's typically a nutrient imbalance. And the quickest way to get that imbalance balanced is to take some supplements. More supplements are not better. Taking 30 supplements a day, I don't recommend that. But kind of figuring out what you specifically need is important. Now, in the realm of fertility, we are looking at essential fatty acids. We are looking at vitamin D, fish oils, those type of things, a B complex, vitamin C, some basic nutrients. Minerals are another one that seem to be highly deficient in people, or have just most people in general, but fertility issues. Folic acid is important. That should be tested though. You don't want to just start randomly taking high levels of folic acid or any high levels of anything, because it can be counterproductive, right? So you want to talk to your doctor or your healthcare practitioner, figure out what you specifically need, make it individualized to what you need, not what your friend is taking, not what worked for them. That's great that worked for them. It does not mean it's what you need. And so proper testing is extremely important when it comes to supplements. Not all supplements are created the same. Most of the supplements on the market are garbage. They are filled with fillers and things that we as humans cannot break down. So it is important to use good quality supplements, working with a practitioner who can tell you the difference between good quality supplements that you can either purchase from them or over the counter with specific brands, because they are not made the same. I never recommend buying vitamins where you buy your clothes or your laundry detergent. You don't want to buy vitamins from big box stores or where you buy your pharmaceuticals. Most of the supplements that are found in the drugstores are also not the best quality. So it's important to understand how to pick a supplement, what you specifically need, and the quality of your supplements. Acupuncture has a lot of known benefits for fertility. In fact, a lot of the IVF institutions actually are now incorporating acupuncture in their process for pregnancy, because acupuncture is its complete own medicine in itself. It can help if you're going through an IVF situation. It can help with implantation. There's procedures and protocols for that. And if that doesn't work, there's a ton of benefits for your fertility doing acupuncture as well. So that is something I often recommend for my patients, and not just chiropractic. I am a chiropractor, but acupuncture as well. The other thing to think about from a structural standpoint is that if you have a history of multiple car accidents, falls, any damage or injury to your spine that has never been treated, oftentimes that could be the underlying cause of infertility. I had a patient years ago, one of my very first patients in practice. They had tried everything and nothing was working. And so she was coming in for care. And at the time she didn't tell me she was having fertility issues. She was just coming in for chiropractic care. And when we evaluated her, she had multiple injuries, a car accident that she never, she got up, she's like, I'm fine, I didn't have to go to the emergency room, I'm fine, whatever. Anyway, long story short, we started adjusting her sacrum, and I remember getting a phone call like on her third or fourth visit saying that they were pregnant, and the only thing that she did differently was start chiropractic care. Because her sacrum and her low back were so jammed for multiple injuries that were never treated or addressed, the nerves that feed the uterus and the ovaries all come from the low back and sacrum. If those nerves are not getting proper flow to those organ systems, it's going to be harder to conceive. So sometimes just getting proper chiropractic care is all a patient needs to conceive. And no, it's not typically that easy for most people, but it is something to consider. And if you haven't done it, I strongly recommend that you get that evaluated. Okay. Lastly, testing. Cannot over just talk about testing, right? Testing and not limited to your hormones. So in the medical world, they just look at your hormones, right? Your estrogen, progesterone, testosterone. They typically, if you have a good doctor, they're looking at your anti-Mullerian hormones, seeing the viability of your eggs. They're looking at FSH, LH, but that's about it. Your thyroid has to be evaluated. If the thyroid is not working well, you're going to have a problem conceiving. You also have to look at the adrenal glands, like we talked about earlier in this presentation. Those are best addressed through salivary testing or spit testing. GI issues. If you have chronic GI issues, that could be the underlying reason why you are not getting pregnant as well. Having that tested, I recommend stool testing. I recommend ruling out SIBO, any kind of large intestine infection, bacterial overgrowth, candida, yeast, mold toxicity. There's a lot of people living in very toxic homes with high levels of mold, which will cause immune and inflammatory reactions, which then will put you in sympathetic dominance, which will make it harder for you to conceive. Getting your micronutrients tested. Are you getting, even though you may be eating well, are you absorbing those things, right? Are you absorbing your minerals from your food? So we can tell that by micronutrient testing, and we can also tell that by stool testing. So getting those things evaluated, seeing where you are, getting all those things working may be just what you need to conceive, right? Having that great nutrient-rich environment creates a better probability of pregnancy. And lastly, remember, just to round it up, the female and male anatomy should be checked, and males should be part of this process if you're in a traditional couple relationship and you're trying to conceive, because it takes two to make baby. And if you don't know what's going on with your partner, you shouldn't bear that responsibility by yourself. It should be both of you being evaluated. So I strongly recommend that you look at this as a couples thing, not just as the female thing. Okay, thank you for spending this time with me today. I really appreciate you being here. If you have any questions, comments, concerns, once again, I can be reached at 703-975-9144, or you can email me, jen@blueskyhealthandwellness.com. Any questions or concerns that you may have, I'd be more than happy to help you answer any questions and just see what you need to have done. I hope you have a great rest of the day, and I look forward to seeing you on our next webinar. Thanks so much.